Should you avoid surgeries on certain days of the week? Hi, I'm Internal Med Doc, a board-certified internal medicine physician practicing close to 20 years, and there's a new study out that suggests perhaps you should avoid Fridays. This study, published in JAMA, looks at 430,000 patients undergoing 25 common surgeries, and they found is that when you get operated on at the end of the week, especially on Friday, you're more likely to have complications and bad outcomes. Now, why is that? Now, there's two schools of thoughts into why we're seeing this phenomenon. I can attest to the first one. When it comes to weekend work, I was once a resident covering weekends. I used to work as an academic hospitalist as well, covering weekends. And honestly, in the hospital during the weekends, there's simply less people around. There's less resources to take care of patients. The post-operative time period is critical for so many patients, especially more frail, sicker patients. And bad things often happen in the first few days after surgery. And if you have less people around, less resources, unfortunately, more bad things are going to happen. Here's the other school of thought, which I'm curious what my surgical colleagues here on TikTok think. Maybe they can attest to this. The article cites that perhaps on Fridays, you have less experienced surgeons operating. More experienced surgeons perhaps take Fridays off, or maybe Fridays are their clinic days, something a little bit lighter, and Fridays fall on the junior members of the team who are less experienced. Is that true, surgery friends? So there you go, folks. If you're getting an elective surgery, something that can wait, something that you have some flexibility, ask your surgeon, ask your doctors maybe earlier in the week if possible. Stay safe and well, my friends.